Turning now to some morning medical news, dozens of health insurance companies are promising to speed up pre-approvals for medical care. The insurers say they'll streamline the prior authorization process that often delays patient treatment. The changes apply to Americans with commercial, Medicare Advantage, and Medicaid coverage. Companies promise a common electronic system that will speed up approval decisions for patients and doctors.
Doctors report that it costs them 12 to 15 hours a week filling out forms. Some nurses are spending over half their time dealing with the administrative burden of this, and healthcare is often delayed to Americans.
The goal is for the new framework to be in place by the start of 2027. A diabetes drug that may also help adults lose some weight could help people who suffer from migraines too. Researchers at the University of Naples say migraine patients who took liraglutide experienced 11 fewer headaches a month. They also reported improvement in their work, study, and social functioning. It affects up to 100 million adults, but many have no idea they have it. It's fatty liver disease. CNN's Mandy Gaither has more on detecting the warning signs.
In 2001, at the age of 45, Pam Miller went in for gastric bypass surgery.
I was finally going to get rid of all the weight that I had because I weighed nearly 300 pounds then.
But she says that surgery was aborted. There was a major problem with her liver, and she had no idea.
I really had no symptoms. Even my blood work was normal.
Back then, Miller says she didn't know anything about non-alcoholic fatty liver disease. It's caused by a buildup of fat in the liver that interferes with the organ's functioning, and that's what she was diagnosed with. On top of that, her doctor told her it was stage 4.
He told me I had approximately 6 years to live, that there was no cure, and, basically, good luck.
Miller decided to get a second opinion at the Ohio State University Wexner Medical Center and learned about how lifestyle changes can help. For her, that meant weight loss.
It's so important to really increase awareness for this condition and for patients to ask their doctors whether or not they need to be screened for it.
Dr. Vivek Mendarata says sometimes blood work can detect a problem, but there's also a screening called FibroScan that quickly examines the liver.
It's essentially just an ultrasound that takes about 10 or 15 minutes. There's no poking, no needles.
It's now been 24 years since her diagnosis, and Miller is still maintaining healthy habits.
I think this is God's will, that I'm supposed to get out and teach others that you need to listen to your body.
Doctors say there are many potential medications on the horizon, including an FDA-approved drug and lifestyle changes.